Welcome to your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to providing lasting solutions. I am your regular anchor, Ushuomowa Daniels. On this week's edition, we are continuing with maternal and child health, with a particular focus on how the poor state of some health facilities and lack of modern equipment has affected maternal and child mortality. We'll be right back after the news segment. Please stay tuned.
For Nigeria to address the worsening health indices, the masses must play their role through regular health checks. This is the submission of a public health practitioner practicing in the United States, Dr. Folake Kofo-Idowu, during a public health outreach in Lagos.
The important thing is to try to stay healthy. And trying to stay healthy sometimes means asking questions when you think it's not needed. Most people, you ask them and they say, oh, I feel fine. You might feel fine, but your blood pressure is high. You might feel fine, but your blood sugar is high. And a lot of these things are silent killers. So my encouragement to everyone is stay on top of your health. Get a primary care doctor. Get annual age and risk appropriate screening. And less need for medical outreaches like this, focused and dedicated to sustainable health care delivery in underserved area and also community development. Also, we try to connect them to follow-up care, which is something that's sorely lacking in our environment.
Very good, very good. We need something like this in our community. They do the sugar, BP. This is the fourth time that we saw this type of thing in our community, and we are very happy.
Dr. Kofo-Idowu noted that healthcare in Nigeria at the primary, secondary, and tertiary levels require help. Urge players to explore the full advantage of telemedicine.
We just need to sit down as a people and figure out what works for us and try to implement it. There is a lot of advancements all over the world, and we can look at all those therapies, all those modalities, and see how we can adapt. It's not everything we can copy and paste. I mean, the world has already moved on to AI. We are still trying to even get good internet penetration. But telemedicine is one thing that can help us fast track, literally leapfrog from being in an archaic system to moving to try to be as current as possible.
Nigeria has one of the poorest healthcare indices measures across the world, with a high death rate due to preventable conditions.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
It is a sad event that I'll never forget. The pregnancy was already 9 months and a week into my EDD. I felt pains and had kicks from the baby. I didn't know that the placenta was strangulating the baby until the baby died due to delay in getting attention.
After carrying a pregnancy for 9 months and waiting for the expected date of delivery, Flora Oladipo delivered a dead baby, stillbirth, due to complications of high blood sugar in pregnancy. If Flora had gotten good antenatal care, maybe the situation would have been different. Like Flora's baby, many died before birth, immediately after birth, or within the first 5 years of life. Current statistics from the Pediatric Association of Nigeria put under 5 mortality rate at 102 per 1,000 live births, and newborn at 34 per 1,000 live births, making Nigeria the highest in the world with child mortality.
You talked about strike. I agree that strike is a challenge, and which is why we always implore on government to please listen to these essential duties, because it is touching lives. When a strike happens, like your experience, anybody can be a victim, anybody. So if there are issues about essential care, my take is that government should always pay attention and do everything they can to make sure it doesn't happen. Now, concerning monitoring, because like you said, it was like something happened and it took a while before it was found out. You are right that it's about monitoring. So we have the rare gadgets. Thank God for technological advancements. There are gadgets that you can monitor babies to know what is happening. But the question is, how widely available are those gadgets? So it's all about empowering our health facilities across the country and then our effective referral systems so that early, if you identify that something is wrong and you don't have the capacity to handle it, refer that patient immediately. Many times the problem comes with delay rather than a prompt referral when the capacity to handle a certain situation is not available. Only 1 in 2 births in Nigeria happens in a health facility. Half. So many births in our country are not attended by skilled birth attendants, and that's a problem. Now, what are the common causes? We have prematurity. We have what we call birth asphyxia, which means baby is born and he cannot cry well. You know, naturally, when a baby is born and comes out, the first thing that happens is baby begins to cry, and everybody is happy that baby has come. But when you have a baby is born within the first minute of life, that baby is not crying, active, something is wrong. And if that something is not corrected within that first minute, then that brain can be affected. So even if you can get that baby to survive, the brain of that baby may not be exactly the same. Many of them die. We also have neonatal jaundice. It's another problem. Yellowness of the skin of the newborn babies. Another condition that shouldn't happen anymore. Hardly seen in developed countries. In fact, when we go for meetings and we say, we see a lot of this, they are quite surprised. Again, ignorance. So because that yellowness of the skin, that thing that is causing the yellowness of the skin, when it gets to the brain, it can destroy the brain. It kills many of them. The ones who survive end up with convulsion problems and their brain is not okay anymore. So those are the challenges we have, and they can be prevented if women can get care during pregnancy. Getting care during pregnancy, delivering with a skilled birth attendant, where even if something goes wrong, somebody knows what to do and does it within the important moment. Not, you see, time is crucial here. We're talking of the timing. Not to be rushing after the problem has started. Yes, you may manage to get the child to live, but what's the quality of that child? So that's what we're talking about. My message to mothers is, 1, even before pregnancy, there should be preparation. Preparation in the sense that you eat well. Because to carry a baby during pregnancy, you need to have good nutrition. So a young woman who is in the childbearing age, they should eat well. And then when you now get pregnant, you should register in a facility early. There are some of the congenital heart problems, like congenital heart diseases. The heart will develop within the first 3 weeks of the mother being pregnant. So antenatal care won't even solve that problem. So if you know you're in the childbearing age, you should avoid some things. Don't just buy medicine in a chemist and swallow anyhow, or herbal concoction and swallow anyhow. You don't know what is inside there that could actually affect the baby. Low immunization coverage. We're very concerned that Nigeria has the highest zero-dose immunization in the world. 2.5 million children in this country have not had immunization. We're also very concerned that Nigeria has the highest burden of child deaths in the world. This country. And it's therefore not strange when you consider the fact that many of our children are not receiving the vaccines that should prevent them from having these killer diseases. We're all witnesses of the diphtheria outbreak and the children that are dying. And most of those children were not immunized. We're also concerned about malnutrition. Half of the cases of child death in this country, the underlying problem is malnutrition. hunger, malnutrition is of concern to us in Nigeria. We're also concerned about child labor. You see children all over the place, they're exposed on the streets, they're hawking, their health is at risk. There's a growing increase of out-of-school children. 1 in 4 children in this country is not in school, and that's not good enough at all. So, as an association, we cannot do all of this on our own. It's a collective effort, and that's why we're happy we're talking to you, the press. Our role is to advocate. We're doctors who treat children, so we're treating children in our different hospitals at the different levels of healthcare. But we can advocate to government, which is what we do. We advocate to the public, which is try to correct ignorance so that some ideas they have, some hesitancy about vaccine, we can try to correct that. We are advocating to you, the press, so you can become our voice out there. You have a very loud voice, so you can now make our own voice louder out there so people can hear what we're saying. Some of the causes of this death are very simple things. Ignorance about simple things. For example, breastfeeding. Why are people not breastfeeding their babies? Breastfeeding is actually the first immunization from God. Breast milk, that first breast milk. Unfortunately, we have this myth that says you should throw it away. But that is the richest of the milk. So simple instructions like that could help change the narrative.
Obviously, there are a number of causes of infant death or under 5 deaths, and infections are one of them. And many of those infections, yes, can be resistant to antibiotics. So, antimicrobial resistance is a problem across all age groups.
One would have thought that the situation is peculiar to those in rural communities. But I began to think differently after my visit to General Hospital Eleme in the oil-rich Rivers State around November 2023, where a high number of neonatal deaths were recorded.
With over years now, we've been saying that children are dying, babies are dying, we're having stillbirths off the charts, and majorly due to various reasons. We have medical reasons, but really we have social reasons and accessibility to skilled care. Our newborns, we have under 1s, we have under 5s, and we have those that are under 14. And I didn't mention, I did, that we have stillbirths. Now, it's a large number of people. Now, for each of those rates, the target is to ensure that at least 50% of those people do not die. That is our target. However, we haven't achieved that target until date.
With the intervention of UNICEF, the hospital has been given a facelift and modern pediatric equipment provided. But experts are not comfortable with reliance on such organizations alone to change our narrative.
We want to thank them tremendously for their continued support over the years. I mean, this is not just the only thing that UNICEF has done for the state, and we want to applaud their consistent support to Rivers State government, and we hope that this will not be the end. Paramount unit was a paramount add to the hospital, along with the oxygen plant that we just came from. UNICEF ensured with their support that we get this thing off the ground. So it's well equipped. I'm holding here a Preminatali, which is something we use for trainings. It's a preterm newborn simulator, amongst other things like as you are leaning on oxygen cannulas and even beds, like you see cots behind you. We also have major equipment like resuscitators. This hospital, along with others, and I have to stress on that, we have General Hospital of Krika, which is not so far away from here. We have General Hospital Bori, and we also have Ogubulo Hospital. Now, within these hospitals, I have not talked about primary health centers, which receive close to 600 to 1,000 children on a monthly to quarterly basis. This itself is a booster to ensuring improved healthcare system overall, the general healthcare system in the state. So that's why, amongst other things, we're excited that this is here at this time. I think this transforms quite a lot of things, and we're going to see a marked improvement in the survival rate, especially with regards to the neonatal period. A lot of stillbirths we have were as a result of decisions that were made before being pregnant, not just even during pregnancy. This is an intervention. This is a timely intervention for Rivers State and the Rivers State people. We are glad that this has come, and we will ensure that we not only stay where we are, maintain it, but also ensure we have more, so that our people have timely and accurate and wonderful access to quality care, especially with regards to the neonatal period in Rivers State.
It's so unfortunate that we could call that a government hospital, which actually depicts the state of public hospitals, public health facilities in Nigeria. You could see how bushy the place was, and from the series you can see that the wheels have not been cut since January. And that kind of place is not safe for humans, given the fact that even the access road is very poor. And I also wonder that even the hospital management will never come out to address us. Maybe it was out of shame. So UNICEF is actually a leading development partner in Nigeria, and I'm very abreast of many of the government's health programs in Nigeria. Most of these things are run by partners, even when funds are even provided for them. You could see that the state is serving or was having just only one oxygen cylinder since its creation in 1967 till date. So there have been none in any of the public facilities, tertiary, secondary, and the primary level of care. We weren't hearing much of health facilities being commissioned or equipment being procured for these hospitals. All we're hearing were rules and others. So what happened to the health sector? So this is a key question that we should be asking. Why should these things not be provided for the hospitals? Why must government wait for UNICEF for this to be made available? The budgets are made available. Where has been the money? Many of the programs that especially the Federal Ministry of Health, many of the programs that they execute are funded by partners. And maybe after these programs, the budget will be made available. Where does the money go? So I can't be asking the partners to be supporting that. The government must also sit tight. They must make these monies available, because these things are critical to the population.
Health is key to the life of this nation. It's just a matter of setting priorities right. As we have said, we have had at many fora, a government that prioritizes building bridges, buying SUV for politicians, paying those who are not supposed to be paid just to sustain themselves. How much at the end of the day does it cost? Will it cost the same government to fund health? Government can fund health because health, security, and innovation. These are the three key things that make a nation. So how can a responsible government not fund health?
A renewed focus on the primary healthcare system and an effective national health insurance scheme are other suggestions brought to the fore by the experts to ensure that Nigerian children have access to good health care and live long to fulfill their potentials.
I work for USAID funded Breakthrough Action Nigerian project, and I'm asking you to watch Health Affair because it is an authentic platform for health information.
If you are just joining us, it's Health Affair on AIT, and next on the program is our nutrition segment, an aspect of the show that focuses on eating right to stay healthy.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices on our nutrition segment every week.
Examples of fat include palm oil, groundnut oil, coconut oil, olive oil, fish oil, and vegetable oils such as soybean, canola or rapeseed, corn, safflower, and sunflower oils. Vegetable oils can be converted artificially to trans fats, which are usually used for commercial purposes. Fats in general are sources of energy and vitamins, but are harmful to the heart and blood vessels when consumed in excess. Industrially produced trans fat has no nutritional benefit and is more harmful to the heart and blood vessels because it increases the level of bad cholesterol in the blood. It is recommended to eat minimal fat and oil in your diet and to avoid trans fat. Limit your total fat intake by adopting healthy lifestyle, such as steaming or boiling instead of frying when cooking, replacing butter, lard, and ghee with vegetable oils such as soya bean, canola, corn, safflower, and sunflower oil. Limiting the consumption of baked and fried foods and pre-packaged snacks and foods that contains trans fats.
On our clinical segment, we give you tips on how to stay healthy.
My name is Dr. Chris Isezabo. I'm a professor of pediatrics and pediatric nephrology at the University of Lagos. I'm a consultant pediatrician with the Lagos University Teaching Hospital, Idi-Araba.
When our children develop yellowness of the eyes, jaundice, we hear all sorts of things that is pawpaw water and all. They know when your child develops yellowness of eye in the first few days of life, you must take your child to the hospital immediately. It doesn't apply to children that, after 3 days, if symptoms persist after 3 days. That's not for children. 3 days is too long.
This is how we wrap it up this week. Thanks for spending your time with us. Let's do it again same time next week. And please do endeavor to advertise your health product and services on the program. I remain yours truly, Ushomowa Danis. Please keep staying safe.